Good morning. What brings you in today?
早晨，醫生，我最近有啲攰，同埋係我嘅家庭醫生幫我做咗啲血液檢查出我有乙型肝炎。
Yes, I have your test results here. The blood work indeed shows that you have hepatitis B infection. Have you experienced any jaundice or yellowing of your skin or eyes?
而家你咁講，我發覺自己皮膚最近係變黃咗啲啲。
The yellowing of the skin and eyes is known as jaundice, and it's a sign that the liver may be affected. Have you felt any pain or discomfort in your abdomen, particularly the upper right side?
有，過去幾個星期，我嘅右上腹部有啲唔舒服。
Hepatitis B can cause inflammation in the liver, which may result in abdominal pain. Have you had any history of liver disease in your family?
我爸爸有肝硬化，但我唔知道係咩原因造成嘅。
Cirrhosis is a serious condition, and hepatitis B can lead to liver cirrhosis if left untreated. In your blood work, it shows that your liver enzyme is elevated. Elevated liver enzymes are often signs of liver inflammation. The liver is reacting to viral infection. We'll need to monitor these levels closely.
我有乙型肝炎意味住咩？
Hepatitis B is a viral infection that affects the liver. It can be either acute or chronic. In your case, the infection is chronic, as the virus is continuing to reproduce, which increases the risk of liver damage. We'll start antiviral treatment to suppress the virus and protect your liver.
我係唔係下半生都需要食呢個藥？
In some cases, yes. Chronic hepatitis B often requires long-term treatment to keep the virus under control. We'll monitor your liver function with regular tests to determine if treatment can be adjusted or stopped.
我係點樣感染嘅？
Hepatitis B is transmitted through blood, semen, or other bodily fluids. It can be contracted through unprotected sex, sharing needles, or from mother to child during childbirth.
我唔吸毒，我淨係有一個老公，我冇聽過媽咪講過佢有呢種病，所以你講嘅呢啲我冇接觸過。
It's possible that you may have contracted the virus through other means, such as from a medical procedure or exposure to contaminated needles in the past. In any case, it's important to focus on treatment now that we know you have hepatitis B, and we'll work on managing it to protect your liver.
好。
Let's talk about the side effect of the antiviral drug. Most people tolerate antiviral medications well, but side effects can include fatigue, nausea, or diarrhea. We'll monitor you for any side effects, and adjustments can be made if necessary.
喺治療期間，我仲可唔可以返工？
Yes, you can continue working, but if you experience any severe side effects or fatigue, we can adjust the dosage. It's important to rest when needed.
飲食有冇咩特別要注意嘅？有冇啲咩可以幫助肝臟？
A healthy diet is important. You should avoid alcohol, as it can worsen liver damage. Eating foods rich in vitamins, like fruits and vegetables, and drinking plenty of water will support your liver health.
我會社交性飲酒，我應唔應該完全唔飲酒？
Yes, stopping alcohol is crucial. Alcohol puts additional strain on your liver, especially when it's already inflamed due to hepatitis B. Also, avoid over-the-counter medications like ibuprofen and aspirin, as these can be harmful to your liver. Always consult with your doctor before taking any new medications.
我通常會食布洛芬子偏頭痛，咁我應該食啲咩替代？
You can use Tylenol for pain relief, but make sure to stick to the recommended dosage. It's best to check with your doctor before taking any medication. I'd like to see you every 6 months to check your liver function, viral load, and liver enzymes via blood work and to do an ultrasound. We'll adjust your treatment as needed based on these results.
我老公要唔要做檢查？
Hepatitis B is contagious, but it's mostly spread through blood or sexual contact. Be sure to practice safe sex and avoid sharing personal items like razors or toothbrushes. It's also important to inform anyone close to you, including sexual partners, so they can get tested for hepatitis B as well.
我嘅小朋友呢？
If your children haven't been vaccinated against hepatitis B, I recommend getting them vaccinated. The vaccine is safe and very effective at preventing the infection. The vaccine is the best way to protect them from hepatitis B.
我唔知佢哋有冇打過疫苗，我會問個兒科醫生，治療大概要幾耐先見效？
You should start seeing improvements in your symptoms within a few weeks, but it can take several months for your liver enzymes to return to normal levels.
乙型肝炎可唔可以痊癒？
Unfortunately, there is no cure for hepatitis B at the moment, but with treatment, we can manage the infection and prevent serious liver damage.
我可唔可以過返正常嘅生活？
With proper treatment, most people with hepatitis B can live normal, healthy lives. You just need to follow the treatment plan and attend regular checkups.
有冇啲咩我要留意？
Be mindful of any new symptoms, especially severe abdominal pain, dark urine, or confusion. If you experience any of these, seek medical attention immediately.
乙型肝炎會唔會自己好返？
In some cases, especially with acute hepatitis B, the immune system can fight off the virus and the infection may be resolved without treatment. However, for chronic hepatitis B, treatment is essential to manage the virus and prevent long-term liver damage.
有冇啲天然療法可以治療乙型肝炎？
While some people look for natural remedies, there's no scientifically proven natural treatment that can cure hepatitis B. Antiviral medications are the most effective treatment. It's important to avoid using unproven treatments that may interfere with your prescribed medication.
我以後會唔會需要做肝移植？
Hopefully not. A liver transplant is typically considered in cases of severe liver failure or end-stage liver disease, such as when cirrhosis has progressed significantly. If we can keep the hepatitis B under control and prevent further damage, a transplant may not be necessary.
我聽講有其他類型嘅肝炎，我應唔應該檢查下其他類型嘅肝炎？
It's a good idea, especially if you've been at risk for other types, like hepatitis C. We can perform blood tests to check for other hepatitis viruses and make sure you're being treated appropriately for all infections.
明白。
Don't hesitate to reach out if you have any more questions or concerns. Take care. Please wait here, my nurse will check you out.
多謝醫生。